So my name is Rachel Pounds. I'm an academic clinical lecturer at the Midland Metropolitan University Hospital and the University of Birmingham, where I work as a gynae cancer doctor and I do research in ovarian cancer. So my research focuses on ovarian cancer and I'm specifically interested in the immune system and how the immune system fights ovarian cancer. So I look at the way the immune system behaves, specific features of the immune system to try and understand how we could adapt or manipulate the immune system to better treat ovarian cancer. There have been huge changes in ovarian cancer whilst I've been working in this area. To start with, the way we try and diagnose ovarian cancer has massively improved. So the awareness around ovarian cancer, the research involved has looked at new diagnostic tests, screening methods, different blood tests, different way of scanning to try and pick the disease up earlier. We've also had massive improvements in the way that we treat ovarian cancer. So the introduction of new treatments such as the PARP inhibitors, there's lots more clinical trials, and the introduction of the HIPEC that we give to some of our ladies during surgery. So in the next 30 years, it would be amazing to have a screening program. I'm not sure if we're going to get there, but better tests. We need massively improved awareness, better ways to be able to pick ovarian cancer up earlier, new treatments. I'd love to see an immunotherapy available for ovarian cancer, and I'd love to be able to see kind of an immune marker that we can use to track ovarian cancer, use it in our monitoring and prediction. So awareness days like this are extremely important for us as clinicians and as researchers, and also for the patients and members of the public. For us, the input that we have from patients and the members of the public is crucial in the research that we do. We need to understand what's important to patients. We need to know what we should be researching, but also their input, their feedback on how we should be doing it. The ways we recruit patients, the way we conduct the research is extremely important. We gain a lot as clinicians and researchers from patients. They help us design our research, share our results. We want to be able to show what we found, and days like this are amazing for us to be able to share our research. I think it's very important for the patients to understand that we are researching, we are trying, things are happening. There's lots of things going on in the background to find ways that we can improve treatment, improve outcomes. I think Overcome is absolutely incredible. They do so much for patients, so much for relatives. I think they are that port of call for patients, relatives to contact. They can spread information, spread the word. They are utmost support for patients in probably the most difficult time of their lives. And I think they really kind of bridge that gap between us in the hospital and the universities and the patients at home. Kind of Overcome is there kind of making a real difference.